redirecting these institutions to actually look at supporting families and youth would really be a way of reducing the wasted social capital that happens when people don't have opportunities. We have 9 million youth living in poverty that actually, if you think about it, are exposed constantly to racial discrimination, their discrimination not only in their jobs but in their education. And this is really creating a system where they feel that even if they try very hard, they're not going to get forward. The feeling of lack of support really transfers to, trying for college, trying for better jobs, trying for better housing. If we were able to support youth early on, it means that we would break the tide. So to try to make changes, you would need to start with actually changes in policy. We need to change policies to have not only a lens of adolescence, but a lens of adolescent disparities, and especially socioeconomic, geographic, LGBTQ, and looking at adolescents through that lens of disparities, so we can actually do policies that align well with the reduction of disparities. I think we need to also change the narrative so that we are really focusing on a commitment to the promise of adolescence, and that means that we are really going to invest in those years, like you're saying, those years under 20s are critical for getting youth into better positions for job employment, for leadership, for civic action. So I think it's a time of importance. And third, I think it's a time where we can really change how the systems work with these young adults, or emerging adults, we would say, where you see that the systems need to radically change how they're working with this population to do a better job in the opportunities and equal opportunities for all. Well, we've learned a lot in behavioral health research, and it can inform policy by first knowing the importance of offering services very early, meaning very early in the teens and early adulthood, particularly because we know that's when, for example, behavioral health disorders crystallize. And if we leave those youth untreated, we're going to have a lot of negative consequences. Unplanned, pregnancies, we're going to have problems with risk-taking behaviors. So behavioral health, all that knowledge can help us in identifying the importance of this prevention, early outreach, and early investment. But then there's also a lot that we know on what interventions work. We know, for example, in behavioral health, the scientific literature has told us the importance of the social context to try to contain many of the problems and remediate. So how nurturing relationships can have an impact in terms of helping youth with adversity. And we can build that in either through civic action, through programs, out-of-school programs, sport programs, to make the connection for youth with nurturing adults that can help them through adversity. It would be a great roadmap for people to take, policymakers, for example, payers, and people that advocate for youth. This is a way that we have already, for example, exemplars of what is working in healthcare for youth. We are hearing from youth, so this report, for example, tells us what youth exactly want out of the healthcare system, the issues of privacy, confidentiality, a friendly youth-serving institution, how they really want to be talked with, not talked to, how they want to make sure that it's a one-stop shop, that things are not fragmented throughout many systems. So we really are learning so much from this report on how we could transform healthcare systems into something that is more attuned to the needs of today's youth.